हम मेहनत कष्ट वालों से जब अपना हिस्सा मांगेंगे, एक भेद नहीं, एक देश नहीं, हम सारी दुनिया मांगेंगे, हम सारी दुनिया मांगेंगे। हम मेहनत कष्ट वालों से जब अपना हिस्सा मांगेंगे, एक भेद नहीं, एक देश नहीं, हम सारी दुनिया मांगेंगे, हम सारी दुनिया मांगेंगे। सागर सागर मोती है, पर्वत पर्वत हीरे हैं, सागर सागर मोती है, पर्वत पर्वत हीरे हैं, ये सारा माल हमारा है, हम सारा खजाना मांगेंगे, हम सारा खजाना मांगेंगे।
Hello friends, today is May Day, May 1st, 2021. You're with Leftward Books and Vam Prakashan, May Day Bookstore, our annual May Day festival. Of course, India is in the middle of cascading crises of COVID-19, crises of hunger, the normal crises of capitalism, the crisis capitalism imposes on people. Confirmed case rate 400,000 per day. India is breaking records. This session is called We Can't Breathe. On a personal note, I think we'll all be very happy. I want to tell you that this session is in memory of our dear friend Amit Sengupta from Leftward Books. We have this terrific book, Political Journeys in Health. I'm going to talk about this at the end. Thinking of Amit Sengupta, who of course at Delhi Science Forum was at the center of trying to get Indian policy in a rational form around pharmaceuticals, public production of pharmaceuticals, and so on. We have an incredible panel. This panel, again, is called We Can't Breathe. We have Satyajit Rath, who was with the Indian Institute for Immunology and now is with the Indian Institute of Science Education. Please go and see his conversation at People's Dispatch on the 20th of April called Need to Strengthen Public Health Systems. It's an incredibly important conversation. We also have Tejal Kanitkar, who's at the National Institute of Advanced Studies in Bangalore. Please see her wonderful report at NewsClick entitled Understanding the Wide Gap Between India's Need and Supply of COVID Vaccines. Finally, my guru and teacher, Prabir Purkayastha, the founder of NewsClick, his latest essay from Globetrotter is called The West, Practicing Vaccine Apartheid at a Global Level. Must read. I'm totally intimidated here because I don't know anything about science. I know a lot about why capitalism is the most wretched system possible and why we can't breathe, but we have to gasp for socialism, as Sudhu said in the first session. Satyajit, over 400,000 confirmed cases. It's just a mind-numbing number. They say it's a new variant. The government of India scientists apparently had a report in early March about this. What's going on in India? Why is India the epicenter of this pandemic now over a year running?
So, Vijay, let me put that in perspective a little bit. It's true that India has 400,000 cases a day as of yesterday, but India is a country of 1.3 billion people. So, how do we do these comparisons is a question worth asking. So, the simple way is to say how many cases per day per million people. And if you look at those numbers, India's number currently, I suspect, stands at somewhere around 300. In January, the United Kingdom showed numbers of over 1,000 cases a day per million population. So, in fact, around the world, even today, India is not the highest number. The number in France is higher, the number in Ecuador is higher, the number in Chile is higher. So this is not a point at which we should be thinking, oh, the virus is hitting India incredibly, uniquely badly. And yet, there is something unique about India's COVID-19 situation. And that is, people are dying for lack of ordinary, simple healthcare. So here's the really distressing, dispiriting, disastrous part of the current situation. It's not that the virus is hitting India particularly uniquely badly. It's that India has failed itself. So what's worth asking is, how did India come to this? Because clearly, both public and private healthcare systems in India, and I'm not going to get into that balance at this point, but both public and private healthcare systems in India have been overwhelmed. Supply chains of the essential medical components, such as oxygen, have been overwhelmed. Let me point out that the one category that these kinds of market-driven perspectives tends to ignore has also been overwhelmed, namely healthcare workers. And this is not simply the physicians, but the nurses, the technicians, the ambulance drivers, all of whom have been driven beyond bearing in day after day of trying to deal with the onslaught of COVID-19 cases. How did we get here? And why are we here despite having had a year to prepare? That's a question worth asking. And hopefully my friends Prabir and Tejal will get into this. But I have 3 quick points about how we managed to get here. One is Indian exceptionalism and triumphalism that is extraordinarily closely allied with the xenophobic nativism of the current government. And as a result, what we have had over the past year is the epidemic as a publicity opportunity rather than the epidemic as an opportunity to re-engineer public health. So what we've had is, simply because the Indian numbers last year appeared to be much lower than those in the global north, ideas about how Indians were genetically resistant, how Indians were circumstantially, environmentally resistant to COVID-19, how India is civilizationally competent to deal with COVID-19 because it has miraculous drugs that its Babas and Maharajas are going to bring up, and how brilliantly India has dealt with COVID-19. This was one component. A second component was the fact that this entire epidemic is being treated in the day-to-day routine administrative governance terms as a short-term crisis. That you grit your teeth, you bear it for a few weeks, and everything will be back to normal. When we know from the 1918 flu onwards, at the very least, we know that global pandemics of this sort do not simply disappear into the air, so to say, in a matter of weeks and months. The third point that I want to make is the point about vaccinations. So we have always known from day one, number one, that we will have good vaccines, good enough to make a difference to the pandemic. That's not a perfect vaccine, but a good enough vaccine. We are going to have many vaccines, and all of these vaccines are going to come from the private sector. And if the vaccines are going to come from the private sector, then the government must, even if it is committed to this utterly stupid idea that a private for-profit sector-based methodology is going to provide a global public good in times of desperate need, the government must at the very least carefully configure a proactive approach to ensuring that vaccine supplies, vaccine supply chains, vaccine development, vaccine capacities, and vaccine implementation programs are well in hand without delays.
Yeah.
And in all of these matters, in providing acute critical medical care of an order that is important, in acknowledging the long-lasting consequences and hardship that are involved, and therefore the governance and policies that are necessary, and in dealing with the private sector vis-a-vis the issue of vaccinations in particular, India has failed itself.
I mean, I think that you've gotten us going on a very strong footing with those 3 points. The first point, let's set aside for now Indian exceptionalism, banging pots, go Corona, go, and so on. We can come back to that if we'd like later, but I think that's the least interesting of the other of the 3. We'll come back to vaccines, Tejal. I think that's really a key issue. Prabir, let's go back to point 2 from Satyajit, which is the short-term thinking, not looking at the long term. I mean, there are queues to get into hospitals, people not able to find hospitals, not able to get tested. Oxygen supplies seem to have been, depleted in many places. Not an enormously complicated thing to make medical oxygen. Cremation grounds stressed out, lines of bodies waiting, no dignity in death and so on. Seems like planning was just set aside for some short-term Mahabharat-like idea that in 18 days we'll end this, the pandemic in India. Modi said famously, like the 18-day battle at Kurukshetra, in 18 days we'll get the pandemic gone. Well, 56 weeks later, we're still there. Prabir, what is it with this short-term thing? Was it callousness? Was it just, bad governance? Was it turn to the private sector, wishful thinking? What went on in the Indian government from the 11th of March, at least when the pandemic was declared, till this recent spike?
That brings in so many questions. So that how do we really look at what's happening in this particular instance as one specific issue? Quick recap. We had 606 cases, I think, roughly. The numbers may be a little inaccurate because you didn't really know. When we had a nationwide lockdown, Modi leading from the front, blowing conches, beating thalis, and 10 minutes of blackout, almost sinking the grid, and so on. Declaring victory after that, though the numbers had, by the end of the lockdown, been much higher, which is not what you normally see in a lockdown. And then declaration of victory everywhere. That, you had the Davos speech where the Modi said, India has shown the way, a huge victory for the world that we defeated COVID. You had the national executive in February, a couple of months back, again showing how India has really driven completely coronavirus away. And I think we had also the Niti Aayog talking about how India has done world-class research worthy of a Nobel Prize. Now, leaving all of that out, what it seems to show is that we started believing our own propaganda, or at least the government did. They were convinced that this one pandemic, one spike, everything is over, everything is hunky-dory now. And they also had, unfortunately, the help of the so-called super modelers and scientists. And, I have to say that we as a scientific community also produce, like any other community, a lot of people who are willing to sing the tune of whoever pays the singer. So given that scenario, we had the so-called super modelers who predicted that we are almost moving towards herd immunity. After February, everything will be over. And this is the problem. The government starts believing its own propaganda. Then they decide, okay, we now need to win the East, the battle of West Bengal. Elections become the norm. And of course, the 5 state elections are there. But the Prime Minister and the Home Minister, as we know, camped in West Bengal. Modi and Amit Shah were camping in West Bengal when the country had started literally to burn. So that also is the fact that nobody seems to be able to tell in the government that, Mr. Modi, we have a crisis on our hands. And that seems to be the other problem, that we have got into a mode of governance where it's only entirely top down. There is no feedback mechanism that goes back to say what kind of crisis we are entering into. What is the crisis we have entered into is also worth looking at. That this crisis is not only of numbers. Yes, 400,000 new cases, we are setting a world record. That's correct. That part of it is true. But also India is one of the most populous states, much more than, for instance, the United States. And apart from China, there is no other country which is the kind of population we have. And China, let's face it, they did something which is stupendous, which no other country has been able to match. So the numbers itself is not the issue. And Satyajit rightly points out, is the capacity of the public health system to take this kind of surge at one go. If it is, for instance, spread out over a much longer period, the numbers, not the new cases, new infectious numbers, but the total active cases, because the crisis is not only 400,000 new cases a day. The crisis really is how many active cases do you have. That means if the pace of the rise is slower and spread over a longer period, then the peak that you are seeing means that all the people are not reaching the hospital at the same time. Your hospital system may be able to handle such a scenario. What happened is then, or what is happening right now, city after city, you can see the hospital systems are getting overwhelmed. It's not one peak in India that we are seeing. We are seeing multiple peaks in different parts of the country, different cities going up, not all together, one after another, not in a synchronized fashion. But yes, there is a logic to it that it is happening in different parts, but a week's, couple of weeks, 2 weeks, 3 weeks later. So as a result, right now Mumbai and Pune might be dropping a bit, but you see Delhi is still going up, maybe flattening a bit. And then you have Bangalore taking off again. You have Kolkata taking off. So you are seeing this kind of things happening simultaneously. This is the time where you needed to actually very early of the peak, of the rise, to really start the lockdowns, selective lockdowns to break the transmission of the disease. And obviously the fact that you have at this time, you have in Haridwar a huge festival going on, Ganga Shnan, Shahi Shran, and so on, the Kumbh Mela. And then, of course, you had the election melas all over the country. And Bengal, you had 8 phases of them, so that Mr. Modi could spend a lot of time in Bengal, campaigning in large parts of the state. Now, those are the things for which you are paying a heavy price. You gave a signal to the people, everything is hunky-dory, you don't have to worry about anything. This is not what the crisis is. That it's all over, pandemic is over. And the last is oxygen, something very basic, something which is available in plentiful or an atmosphere. 21% of our atmosphere is oxygen. So that should not have been a logistical issue. But look at what we did. We took 10 months to order what the PSA plants, which are small plants, not big ones, small plants. And that would have only given us something like 2% extra oxygen. But we had the capacity to order 500 such plants because the cost was a very small fraction of what the PM CARES fund is, or what Nirmala Sitharaman had earmarked for COVID-19 in the budget, 35,000 crores. So we could have actually spent, instead of 20, 30, 200 crores, we could have spent something like 2,000 crores and given at least 10-15% of oxygen in the hospitals, close to the hospitals. So what would have happened is the logistics would not have been the issue. At the moment, the big problem is we have liquid medical oxygen we can produce because we are diverting industrial oxygen into medical oxygen. And that is a significant amount, but we are not able to reach it because we don't have tankers. The tankers that we have roughly are 1/3 of what we need to meet the kind of city demands that we see. And let's face it, we are talking of the major city demands at the moment when you talk about oxygen. Small hospitals in what is called Mofassal India, or in the rural areas, what's happening, nobody's even documenting those numbers. So even for the major cities, even for the capital city, we're not able to provide oxygen. That is a crisis of planning, as you said. And that crisis of planning is just to take a spreadsheet, look at what the numbers you're likely to get. Apparently in February, the prediction of 300,000 was there, that it could become 300,000. We should need to prepare for it. It wasn't done. It's a tragedy that the National Task Force didn't meet for months, and it only met after the crisis was in full swing. So these are the things that happens, and this I'm reminded of really a kind of Mrs. Gandhi emergency regime, where people were afraid to tell her the truth of what's happening. We have now a centralized system, a quasi-anointed emperor elected by the people, a constitutional elected leadership, if you will, which is completely immune to what the people think or say, because there are a whole number of sycophants telling him what he wants to hear. And if anybody says something he doesn't want to hear, then he will not be there too long in the cabinet or in the government, wherever it is. So I think we have reached a situation where there is no feedback in this government. And that's the crisis that we see, the lack of feedback. And then I must end with this, that what you then see is that instead of the message, and this, since we are media being the message is the media, that's what we are supposed to give. What the government now wants is to massage the message. So massaging the message, massaging the narrative is what, for instance, Yogi Adityanath prescribed. Of course, Supreme Court has reacted to it, so that you drown out the true reality by now demanding everybody should emanate positivity and not show negativity. So that's where we are at the moment. But I think for the first time, this part of it is breaking through. And I think there is a lot of anger and unhappiness with the situation right now. What turn it takes politically, whether people raise the kind of issues Satyajit has raised, planning, public health, that's something that we will have to see. And it's also in our hands what we do.
Well, one thing I can say for quite certainly is from January, February, March of last year, the three of you have been writing, raising the alarm on different things, giving interviews and so on. Tejal, last April 2020, you wrote that the Nirmala Sitharaman's budget, the COVID relief package was inadequate. That was a canary of their lack of forethought, planning, and humanity. Can you go back? I mean, Satyajit and Prabir have taken us back a little bit. Can you go back and also tell us a little about how we got here? And of course, here is not static. Here is an ongoing here. I don't know where it's going to go, but how did we get here?
Yeah, I think, both Satyajit and Prabir have spoken a little bit about how we got here. I mean, all of the discussion so far has been about the utter incompetence of this particular regime. I must confess that for a very long time, I would think of this particular government as malicious towards certain communities, definitely authoritarian. But the utter incompetence, I think, is quite evident, much more so right now. Of course, in terms of their the miserly nature of the package that they announced in the first round, and then they said that there's going to be a 20 lakh crore package, etc., which was also, I mean, multiple commentators showed that it was actually already part of the budget. It was they were sort of just repackaging, massaging the numbers here and there, and showing them as new money, which was really not new money. So of course the result has been that we are where we are. But in all the things that they did announce, they announced a 35,000 crore separate budget head for COVID-19 vaccines alone. When they did this. Now, what was that money for? Was it for providing vaccines to people, administering vaccines? Was it for the National Institute of Virology, and the ICMR to actually develop the vaccine? Because there seems to be quite a lot of public money that has gone into developing the Covaxin, the one that has been, the license for which has been given only to Bharat Biotech. Despite multiple public sector vaccine manufacturers being available. I mean, the Supreme Court itself has asked these questions of this particular, of the central government. But of course, how far the Supreme Court will take this, we don't know. So we have to keep raising some of these questions. But to stress on the vaccine story, I want to sort of just elaborate on why I think this particular situation that we are in right now, especially on the vaccine front, shows up the government's incompetence quite completely, because this is also, this is just simple arithmetic. You don't need supermodels, and some detailed projections, forecasts for the future. You have to do some just simple arithmetic to even, meet your own targets, the targets that you've set yourself. So, for example, on 12 January, before we started our vaccination program, the Ministry of Health and Family Welfare issued a press release that said that they're going to prioritize vaccination for an estimated 10 million health workers, 20 million frontline workers, and an estimate of about 270 million people above the age of 50. And those below the age of 50 with comorbidities. This is a press release that's available. It's public information. So now, from where it arrived at this 270 million number is anybody's guess, because their own population estimates show that this number is actually higher. But nevertheless, this rounds up nicely to 300 million. You have 270 million people above 50, and you have 10 million health workers and 20 million frontline workers. Now, at 2 doses a person, for this priority category that you yourself say is priority, you obviously need 600 million doses. And from the time that we've started, from 16th January till now, till 29th April, we have administered about 149 million doses only. So, which means that, of course, and, since then a lot other people have also been made eligible, those who are not above 50 or with comorbidities or frontline workers or healthcare workers. So this, some of these 149 million doses have also gone to others. So which means that your own priority category, you've not even met 25% of that particular number that you had, that you'd spoken about when you started the vaccination. And now you make the, vaccine, the eligibility criteria, you open it up, make everybody above the age of 18 eligible, when the supply situation has not changed at all. And this is what Satyajit ended with. He spoke about how there has been absolutely no planning in terms of vaccine. We all knew that the vaccine was going to be available. India's requirement in terms of its eligible population, how many doses we would require if 2 doses per people to cover the entire population. It's not as if our population has grown overnight. We knew this 6 months ago. So, we could have planned for this much better. Instead, what we have now is a declaration of eligibility for everybody over 18. So you're increasing essentially the denominator without the numerator increasing at all. So you have lesser doses available per person as more and more people get eligible. And you have a severe supply constraint. We have a supply of around capacity to supply of about 3 to 3.5 million doses per day. We are currently administering about 2 million vaccines a day. And we need about 7 million doses a day to cover the entire population by the end of this year. So in this situation, what you have is the liberalized market for vaccines, which I find it really bizarre, because even the most neoliberal, neoclassical economists will not say that this is a good strategy. You have Arvind Subramaniam, the government's former chief economic advisor, actually say that this is foolish. It's a foolish strategy to go into when you have essentially a monopoly. The Serum Institute of India produces 90% of the vaccines that we have right now. We've sat for months on allowing other vaccines to enter the country, some hubris of an Atmanirbhar Bharat and our own vaccines. You have given sole licensing to Bharat Biotech, where you have a huge amount of public sector capacity available. Now they're charging, and you've allowed them to declare their own prices now, which they've declared, which are higher for the private sector, which means that they'll prefer selling to the private sector. This is going to depress vaccination rates even further. You've left states to fend for vaccinating a large majority of the population, and ironically, it's some of your own states that are the laggards. So it's BJP states like UP, Bihar, etc., that are actually lagging behind in vaccination, and these states are going to suffer even further. And in the long run, if you don't vaccinate enough people fast enough, you're going to keep seeing surges, and if it's going to keep leading to economic upheavals, it's not even good for capital. So it's like capital trying to shoot itself, and it's really bizarre, because I mean you have the advanced capitalist economies also not doing this, precisely because it's not even good for capital in the long run. So it's almost as if the Modi government doesn't even know how to do capitalism properly. So I'll stop with that and maybe take the conversation.
The Modi government doesn't know how to even do capitalism properly. It is not that our population increased overnight. Thanks, Tejal, for so many tweetable quotes. That was incredible. The health minister of Kerala, KK Shailaja, gave an interview. She said that if we, meaning the left, was in power in Delhi, we would nationalize the health sector. If we nationalize the health sector, I would like the three of you to run it. Really smart people. I want to pull the camera back a little bit, Satyajit. Let's go back into the science. People like me confused about what's going on. Couple of things, Satyajit. One, people hear the phrase herd immunity. It was used a lot last year. What is this thing? I'd like you to just give us a little primer. It might help the discussion on vaccines, which we're going to go deeper into after Tejal's introduction to it. That's one. The second thing people have been talking about is this new variant. Is this going to be, is the vaccine going to be able to handle this or not? There's a lot of confusion out there on herd immunity, on variants. Just give us a little primer in that beautiful way that you do.
Okay, so let's talk about herd immunity first. Because as you point out, Vijay, there's a great deal of confusion about the idea. So let's take a somewhat historical view of where the idea comes from. And the idea comes as an explanatory notion for the following apparently paradoxical finding. You have an infectious disease. You have either vaccinated or otherwise rendered about, say, 75% of a population immune to that disease, which means you have 25% of the population still susceptible to the disease. And yet, the disease cases disappear. So you say, hey, what on earth happened? Why aren't these 25% who are susceptible falling ill? And you say, aha, we have an explanatory model. We call it herd immunity. What do we mean? We mean that when the disease is transmitted from one person to another, the statistical probability that each transmission runs into the dead end of an immune person is so high that transmission chains that eventually do manage to find somebody susceptible simply don't get initiated. And if that happens, we say herd immunity, which protected the unimmune, the unvaccinated, was hit with a 70% or a 75% or an 80% coverage of immunity. And from this description, you will appreciate that the idea of herd immunity is a retrospective explanatory. In order to arrive at that as a prospective policy prescription, you have to know a great deal about the disease, about immunity to the disease, as well as about the societal parameters, the cultural economic parameters that control potential spread related events. None of this do we know about a disease that we've been familiar with for less than a year and a half. On what basis, since last year, globally, were people talking about achieving herd immunity? So, in the first place, there ain't no such easily, robustly, reliable target of herd immunity to shoot for. Number one. Number two, how do you estimate what proportion of people are immune? So one of the instruments that has been used the world over, and India used a fair amount of it, is called serosurveys. You basically look in statistical samples of communities, how many have antibodies to the COVID-19 virus. Because if somebody has antibodies of a certain kind to the COVID-19 virus, they've been exposed and they are likely to be a little bit better protected than if they didn't have the antibody. But if that's the case, then your serosurveys must be statistically so robust that you have both a very granular, at a micro level, careful understanding of the variations at a nationwide scale over time, because the pandemic is an ongoing thing. Have you done any of this kind of exercise in serosurveys? Do you have such a nationwide, extremely granular serosurvey going? No, you don't. So on what basis were you making all these claims? And it turns out on no basis whatsoever. On casual, small, micro level, modest studies that were being interpreted in massive fashion. And this brings me to the issue of the variants. So the issue of variants is as follows. Every organism, when it multiplies, creates copies, progeny, that is not absolutely identical to itself. So there is a certain amount of genetic variation available. This genetic variation usually doesn't mean anything unless the population growth of the organism is put under some specific pressure. If it is put under pressure, then those variations that get an advantage of survival and growth under that specific condition, those will become more and more prominent in the population, and that's what we are seeing as variants. Here's the really interesting thing. Across the world, the pressure that we have put on the virus is physical distancing. In other words, we have made it harder and harder for the virus to be transmitted. And as a result of that selection pressure, across the world independently, the kind of variants that are beginning to get selected and that are emerging across the world, this is not one variant, this is a whole massive series of variants independently generated, but all of them share a property, they are more easily transmissible. So it's no surprise that in India also, these variants are arising. Also, we exchange variants, of course, across the world, no question about that. But there are homegrown variants as well as imported variants. But here's the really problematic thing that connects to the serosurveys. In order to understand the landscape of variants, we need to know what variants are around. Now, think about this number. Yesterday, we had 400,000 cases of COVID-19 recorded. We don't know how many real ones, but recorded across the country. The general argument that people have made is that it would be nice if about 1% of all of the virus in all identified cases could be fully sequenced so that we have a really good snapshot of variants. So 400,000 cases a day. How many Indian variant virus sequences do you think have been recorded and are available for analysis? That total is 16,000 as of yesterday. 1630. It's not even one day's robust statistical sample, leave alone a whole pandemic statistical sample. So on what basis can we say, what role are these variants playing in the current increase in numbers? Two more points about the variants let me make quickly. One is the fact that India's current disease numbers are not dealing with one variant alone. So our extremely inadequate variant-related evidence, even that says that B117 seems to be prominent in northern India, B1617 seems to be prominent in western India, B1618 seems to be prominent in eastern India, and a somewhat less characterized set of strains that are none of these three seem to be somewhat more prominent in southern India. So even at our very crude and inadequate level, it's very clear that, as Prabir pointed out, what we have is a series of local outbreaks, each with its own dynamic, its own constraints, and its own factors and determinants. And the final point about variants is the issue of, do vaccine-mediated immune responses protect against variants or not? And the question has not yet been answered, properly speaking, for any vaccine in the world in any definitive fashion. There is evidence that the amount of protection is somewhat reduced for variants. However, and here's the really important matter, this reduction is quantitative. It's a matter of degrees. This is not a yes-no event that should terrify us as far as variants are concerned. And protection against variants, as well as against the original virus strain, always appears to be best at preventing extremely serious illness and death, and less at preventing mild illness. So the current vaccines are really good vaccines. What we have been calling over the past year first-generation vaccines are very, very useful, no matter whether we have a future with variants and next-generation vaccines coming up. The real problem, as Tejal pointed out, is that we've simply not planned for credible, adequate vaccination campaigns to scale.
7.9 billion people around the world need to have listened to that 7-minute explanation, Satyajit, because people don't know what's going on. And I must admit, sometimes listening to you, I get a little scared because of the clarity with which you pose the threats and the ways in which we deal with them. On the other hand, it's a lot better to know things with some precision than with no precision at all, but with rumor. And what you say about these surveys is, it's chilling that modern governments with the capacity to go out there, create big sample sizes, and they just don't do it. It's chilling. It tells you something about the incompetence that Tejal talked about, and maybe even what Sainath used, a much harsher word, Tejal. He talked about the cruel sadism of the government. But incompetence, I think, is enough to get a government elected out of office. But of course, that's a different story. Let's then pick up, Prabir, where Satyajit left off, which is that these first-generation vaccines, they're good vaccines. People should be having vaccines and so on. Yet, Tejal wrote in an article that in India, it seems that at the current rate, she writes, vaccination will only happen by November 2022. Just to remind you, we're in 2021. Today is May Day 2021, in case you've forgotten what year we're in. And Tejal says that India will not be vaccinated until November 2022. That's the following year, friends. We'll have one more May Day before complete vaccination at the current rate, it should be said, because this rate could be picked up. Prabir, why is the vaccination rate so low? And I want to get into the fact, Prabir, that, look, there are vaccines out there. There's Sinovac, there's Soberana, the Cuban vaccine. Why aren't people just producing these vaccines? You don't need doesn't seem to me you need a WTO waiver to do these vaccines. Why aren't these vaccines being produced?
You know, the vaccine issue has got really entangled now into a vaccine war and vaccine apartheid. Let's just look at first who are getting the vaccines and who are not. The United States argument has been that it's like the aircraft, the first-class passengers, namely the Americans, will have to get all vaccinated before vaccines can reach any other place in the world. And even if intermediate goods, other raw materials are required to come out of the United States, even that the priority will be for the American vaccine manufacturers, and nothing will go outside the country. They don't call it an export ban, they just call it by a different name. privileging the local manufacturing and giving them the first dibs on whatever is required. Now, given that scenario, if you look at what's happened, you will find that the rich countries have not only blocked vaccines for themselves, which is what they have done, they've exchanged vaccines between themselves at best, though there are frictions with the European Union and the United Kingdom on that. But the point is that essentially the global rich, countries belonging to the global rich are vaccinating themselves. When you talk about Africa, which does not have vaccine manufacturing capacity, there you find that virtually very few numbers have reached. Whatever was reaching from Serum Institute via Covaxin platform is also stopped at the moment, because India, the way it has been, the numbers have shot up. It's bad optics for the government to allow any export in any case. So that has also been stopped. So Africa has been left without anything. The only one small country, I think, has got some vaccines, but that's about it. Now, given that scenario, that's why we let's give it a correct name. It's really vaccine appetite that we're seeing. And next, what is in the offing, which is also so heartless and cynical about it, running down all other vaccines except Pfizer and Moderna vaccines. Basically, AstraZeneca somewhat, because AstraZeneca has run into criticism from European Union, and part of it is political, part of it maybe a little bit of medical hiccup that might be there. But let's face it, that anything that you read about the Chinese vaccine, you will say, oh, it's very poor, not as good as Western vaccines. Well, Moderna and Pfizer require ultra cold chain, which in large parts of the world is not going to be available. So let's forget about Moderna and Pfizer. And AstraZeneca's figures are actually no better, if not worse, than Sinovac or the Gamaleya. Gamaleya vaccine figures are pretty good. That apart, now you have continuous campaign against Chinese vaccines, you have a continuous campaign against Russian vaccines. You are really seeing a battle. After the rich countries have vaccinated themselves, the battle is now to capture the market for vaccines in the world, and therefore you have to run all other competition out of the market. And that's what you will see. And unfortunately, the Western media is playing a complete role of spokesperson for Pfizer and Moderna, running down all other vaccines. Even the Bharat Biotech vaccine, which is very similar, the one that has been Covaxin, which has really been developed by the National Institute of Virology at ICMR, is very similar to the Sinopharm vaccines. And what you find in all of them now is an attempt to run all of them down. So I think we are really seeing, as I said, a combination of vaccine appetite and vaccine war as a part of the larger geostrategic war. And it's also about who captures the vaccine market, who makes the money. And there, of course, I don't know whether you know this, Vijay. Of course, Amit's book has it, that in the 50s and 60s, the pharmaceutical companies in the United States said, we are a part of the American military battle to capture the world against this evil communists. So it was portrayed as a part of a strategic arm of the United States. And there is also the mention about, by the way, vaccines, that how that they had defeated an attempt by the Russians to enter the Indian vaccine market, which finally India did manage to do, because Sahib Singh Sokhe was a communist, led that attempt to get the first really vaccine manufacturing at scale in India, and that was at the time was thought to be sabotaged. That is the public sector which we are today. We have forgotten in the love for the private sector in India.
Well, we're going to wrap the panel up in a minute or so. Prabir, you mentioned Amit's book. You mean Political Journeys in Health from Leftward Books. Our dear friend Amit Sengupta spent a considerable part of his life fighting for public health, for countries of the world to respect the Alma Ata Declaration, 1978 of the World Health Organization, fought for years against the revision of patent laws, the TRIPS and TRIMS agreement in the General Agreement on Trade and Tariff. was a leading contender, fighter for public sector pharmaceutical production and so on. Everything that Amit fought for, everything, if it had come to pass, would have made this catastrophe much less than it wouldn't have been a catastrophe. It would have been something we could have dealt with rationally, perhaps like other rational societies have dealt with this issue, this pandemic. We saw the Chinese state deal with it pretty rationally. I'm allergic to penicillin, guys. I don't know how many of you are. Penicillin, when it was developed in Oxford, I believe, they decided not to patent it. And when I was a child, visited, I think it's near where you are, Satyajit, Hindustan Antibiotics in Pune. 1954, it was set up, and one of the first things it produced was penicillin, without any consideration for patents or anything like that. Because guess what, friends? What is medicine for? It's to ease the sufferings of human beings. It's not to make money off of. What is education for? It's to ease the confusion of human beings, not to make money off. These things should be in the public sector. We've had a terrific panel today with Tejal, Satyajit, Prabir, talking about the fact that there is, despite India's large population, something of a catastrophe that the Indian people are going through. COVID-19, yes. Hunger, yes. Toxic political and social environment, yes. You've been with us at Leftward Books and Vam Prakashan. It's May Day 2021. We have more panels coming up. The next one starts in about 10 minutes. We end the day with Rahul Ram, who, by the way, also is a scientist. I don't know if you guys know that. He sings for Indian Ocean, but he's a scientist. Will sing us a song at the end to close us off. So keep with us at the Mayday Bookstore YouTube channel. Thanks a lot, Tejal. Thanks, Satyajit. Thanks, Prabir. It's been a pleasure.